Well, let's discuss this now, and we're joined by UNAIDS Director for South Africa, Eva Kiwango, who joins us via the virtual platform. Ms. Kiwango, good evening to you, and thank you very much for your time. So let's start with the positive aspect of your data, which shows that there is the greatest decline in HIV infections in sub-Saharan Africa. What is the region doing correctly this time around?
Thank you very much, Corley, and good evening to you and your viewers. And thank you for the opportunity to be here to talk about the new UNAIDS 2024 Global Report titled The Urgency of Now, AIDS at a Crossroads. So the report is really talking about the agency of now. We're 6 years away from 2030, and as a world, we set ourselves a target as part of the Sustainable Development Goal number 3, to end AIDS as a public health threat by 2030. So this report, as you say, is capturing, a plethora, a lot of good news around reduction in new infections. In South Africa, for example, there were 150,000 new infections in 2023, but this represents a 72% reduction since 2000. Even though, new infections around in women still remain high, and they make up 64% of all the new infections in 2023. We've seen marked declines in AIDS-related deaths. 50,000 people living with HIV died of AIDS-related deaths in 2023. And we also saw, treatment expanding a little bit slowly, but we are heading towards our target, and we have now 5.9 million people accessing treatment in South Africa. Yeah. Now, we are doing quite a few things right, and the path to end AIDS is not a mystery. It's a political and a financial choice, and South Africa is making both of those choices.
Very interesting indeed. So let's talk about what is the contributing factor to the decline, because that's something that should be multiplied. I'm sure you would agree. So what is it? What is part of this solution, or what is the ingredient here? Could it be that there is also the ease with which people can be tested for HIV?
So there are several things. Like I said, the path to ending AIDS is not a mystery. That we are doing right in South Africa. And I think the first one is political commitment, and not just of our leaders in South Africa. HIV sits within the office of the Deputy President, but premiers, our mayors, civil society, everybody is coming to the table, because this is an all of society effort. To end AIDS, we need all of society there. We need the private sector there. We need research institutions there. So they're all coming to the table. So political commitment is one. Yeah. The second thing is resources. South Africa is paying for its HIV response. It has invested heavily. 70% of the response is coming from domestic coffers. And that is quite a substantive amount of money because of the number of people that are on treatment. So South Africa is paying for most of the medicines that we are used to keep people on treatment, even though Global Fund and PEPFAR contribute 20%, and that's also millions of dollars there. So resources are being invested as well. And those are the two things. But of course, like I said, the treatment program, massive scale up. We are talking about addressing, issues around the structural enablers, the things that prevent people from staying negative and from accessing services. So addressing gender-based violence, addressing human rights issues, making sure that we're addressing stigma and discrimination. All of those things are being done in South Africa.
Yeah. Despite this progress, though, there does seem to be a drawback. And again, I would like for us to focus the attention on South Africa. Earlier this month, on this channel, we reported about babies, 200 of them. In fact, the exact figure is 230. These babies were born with HIV, despite the availability of medicine that prevents the mother-to-child transmission? What could be going wrong there?
So we are failing our children, and we are failing our children globally, not just in South Africa. But it is an injustice we can correct. And South Africa has joined the Global Alliance to End AIDS in Children by 2030. It's part of the first phase of countries, and it's committed to correcting this right. In 2023, 6,500 children below the age of 15 acquired HIV. However, there were many more acquiring HIV in 2010. There were 28,000. So this represents a 62% decline. So we've made progress. We've seen incredible scale up of treatment for mothers, pregnant women who are HIV positive. They're starting treatment so they can prevent the vertical transmission of HIV to their babies. But despite this progress, as you correctly say, there is a lot of transmission that's still happening, and most of it is happening during pregnancy and breastfeeding. And there are several reasons for this, from not knowing their HIV status, parents not knowing their status, not getting tested early during pregnancy, high rates of unplanned pregnancy, gender-based violence, the lack of knowledge. There are a lot of things that are coming together to create this storm. But to address these challenges, the Alliance, the Global Alliance, under the leadership of our patron, who is the Second Lady of South Africa, the spouse of the Deputy President, we are aiming to ensure that we scale up infant diagnosis and find the 75,000 children who are not on treatment and put them on treatment by the end of 2025. This is a commitment the country has made. Scale up pediatric dolutegravir, which is a medicine that's more easy to take and to keep down in children, to strengthen integration of HIV services so we're not losing the mother and the baby when they leave the clinic after birth. We are making sure that we keep track of them. And we want to strengthen data systems to allow us to track the pregnant and breastfeeding women and their babies, as well as scaling up pre-exposure prophylaxis to prevent pregnant and breastfeeding women from acquiring HIV. I said that's where most of the infections are happening. And then lastly, addressing gender-based violence, stigma, as well as other social determinants of health like poverty and keeping girls in school.
Yeah. Earlier you touched on targets, and there are many of these targets that continuously are made in the fight against HIV/AIDS. And one of those is the slowing down, or perhaps even to a point of reducing dramatically the deaths because of HIV/AIDS. And there is a target of 2025 to reduce the deaths significantly. How are we doing in South Africa on that score?
So as I said at the beginning of this interview, South Africa has managed to reduce quite a few of the HIV indicators positively. And one of them is AIDS-related deaths. So we have managed to cut down the number of AIDS deaths by 80% since 2004. Let me repeat that, 80% since the peak in 2004. In 2023, we had around 50,000 people dying from AIDS-related illnesses. So this is compared to the number of deaths that happened at a global level that were 630,000. So this is one indicator where we are not necessarily at the forefront of contributing to that data, but we are because of our burden. But AIDS-related mortality has declined significantly by 69% among women and girls, and by 64% among men. However, every minute someone dies of AIDS. But there's a lot to say about the HIV response in South Africa. The treatment program has, contributed extensively to increasing life expectancy. Many people now are on treatment. We are at 5.9 million people on treatment. We still need to find and get around 2 million people on treatment, 1 million to achieve the 95 targets that we have of people knowing their status, on treatment and virally suppressed.
Yeah. Let's conclude the conversation with the area of research and development, because that is, it plays a very important role. I want to go straight to the head. Is the world any closer to finding a cure for HIV?
So, Corley, I think we should focus on the positive news. That's a great question, but I want us to first focus on the positive news, and that is the news around the powerful prevention technologies that are coming to us. And this includes oral, it's a tablet, and long-acting injectables, where you get an injection to prevent exposure to HIV. So pre-exposure prophylaxis. Now, these technologies we had the proof that cabotegravir was able to prevent new infections. It's an injection that you get every 2 months. And now we have another new tool in June. And we're really excited about the findings of this extremely highly effective PrEP called lenacapavir. And the study, the randomized control trial that was done, in that trial, none of the 2,100 adolescent girls and young women who received this injection twice a year, you get injected every 6 months, none of them acquired HIV. Now, this is extremely great news. We can add this to our toolbox of preventing HIV. And when I say 100% efficacy, that's nearly, it's very close to a vaccine. So what we need now to do is to make sure that this new technology, this new long-acting injectable is available in South Africa. And that is why we are all pushing Gilead, the company that owns the patent for lenacapavir, to make sure that it is opening it up to the UN-backed medicines patent pool to allow generics to be sold under license to low and middle income countries, including South Africa, which is an upper middle income country. So we're calling on Gilead to make sure that this technology is available and we can produce generics and they can be made available. It is only when new technologies are made available that they can contribute to preventing millions of new infections and saving lives. So we're working very closely with our partners. Right now in the US, lenacapavir is $40,000 a year. Many countries cannot afford that in the South. So we're pushing for the price to come down. And one way of doing that is by opening it up and providing licenses for companies to produce generics.
Eva Kiwango, let me thank you very much for your time. UNAIDS Director for South Africa, talking about great strides that are being made to try and fight against HIV and AIDS.